Hello, my name is Vince Fauntleroy, and I'm a student at Kesier University in Port St. Lucie, Florida. And I'm currently in a class called Care and Prevention of Athletic Injuries. And the injury I'd like to speak to you today about in this video is medial tibial stress syndrome, or commonly known as shin splints. Some of the areas that will be discussed will be the anatomy, prevention of the injury area, and recognition and management of the actual injury. So I hope that you learned something and join me on this journey. The term shin splint is a catch-all that has traditionally referred to any type of pain in the anterior aspect of a lower leg. Medial tibial stress syndrome, as it may be correctly called, is a condition that involves increasing pain significantly to the distal 2/3, this area here, the distal 2/3, it comes from this area here behind the medial malleolus and it runs up of the posterior medial aspect of the tibia. A strain of the posterior tibialis muscle and its fascia sheath at its attachment to the perineum of the distal tibia during running activities is most likely the mechanism for injury. And that would be in this area here. The fascia is the area between the bone and here that is actually covered in. Whew. Signs of injury. Pain is usually diffused about the distal medial tibial and the surrounding soft tissue. Initially, the area may not only hurt after an intense workout. As the condition worsens, daily ambulation may be painful, and the morning time and stiffness may be present. Medial tibial stress syndrome can progress to a stress fracture, and if not treated properly, it can be worse than what it is and become stress fractures. 98, 99, 100. Care. Management of this condition should include physician's referral to rule out any possible signs of a stress fracture via the use of a bone scan or plain films, which are x-rays. Activity modifications along with measurements to maintain cardiovascular fitness are set in place immediately. You don't want to lose your gains, so my friend Latasha here has shin splints, and she's been complaining about the pain. So I'm going to show her a couple stretches and a couple exercises and other modalities that will be able to help her with her actual condition. All right, Latasha, if you're feeling the pain there, if you can put your toes down in a plantar flexion, extend it here, and lean forward, and let your laces, you feel the pressure here, you feel it stretching in this area? That would be one stretch that we can do. If she wants a deeper stretch with a little more pressure, she would come back and kind of sit towards her heels with her chest up. And that'll also apply the pressure to give her a good stretch. After doing those stretches, to strengthen that area, I would have Latasha stand up. And she would go inner rotation as if she was pigeon-toed. Like this, ma'am. And she's going to raise up on her toes. Do you feel that? What she's feeling there is that stretch. That stretch is actually what she needs to strengthen the muscles to stop this condition. Okay? If you can have a seat. There's a couple things that we could do before we get into the actual activities or exercises. This here, it would go under here, and she'll keep this dorsiflexed, and she'll pull herself up and roll forward on the calf to release and break up the fascia, the myofascia on her calf to give her a better stretch. You see how she's doing that? Now if I can have you turn around and do the same thing to the front side where the shin is, and that muscle group here, it'll give you the same relief. This area here is where she's actually rolling in the front side. And on the back side, the medial tibialis, she's rolling on the calf to release this tension here, which is going to relieve this muscle here because the muscle innervates with inside the foot. Okay? And as you can see, all right. Okay. Now, after I take this out, what she would do after that is, say this is a golf ball, and what she would do is she would take her shoe off and place it under her foot. You can stand up. And because where she's experiencing the stress, because if you see here, it actually innervates inside here. So what we're going to do is we're going to take the ball and we're going to roll it within this area, and it's going to be the same as the myofascial release with a roller. So we're going to do it because it comes in here and a lot of stress is there in the arch. So we're going to massage that area with the ball. So she's going to show you and demonstrate here. So she's rolling it around, she's putting slight pressure on it, and that's going to relieve some of the pain and tension. And you can also, if you're going to tape, you could C-tape and tape the pressure. On this side, it'll be tight, bring it around slightly behind the calf, and then anchor it in. And that'll also relieve the pain as well. And after she does that, she would take the roller and a downward motion on these muscle groups and on the back, doing the same thing as well. Shin splints often heal on their own. If you see a doctor, expect to go through a physical examination. Your doctor may want to look at you run and look at some of the other problems you may be having. You may also need an x-ray or a bone scan like I said before. You must rest your body. It needs time to heal. Rice is a good principle to live by. Ice your shins to prevent shin splints, you should always wear shoes with good arch support and never wear shoes more than 300 to 500 miles, as this may break the shoe down and no longer give you the proper support that you are needed to not get shin splints. Warm up before you work out, making sure that you stretch your muscles in your legs. Stop working as soon as you feel pain in your shins and begin to stretch. Also, to do a myofascial release before you do your workout. Do not run or play on hard surfaces like concrete, and try not to switch different consistencies as far as concrete, grass, as this may cause more trauma to your body and cause for shin splints.